Was welcoming everyone. I welcomed everyone, and I'm also introducing myself. I'm Dr. Ayomide Fainto, and I'm a women's health advocate and educator. Um, the desire to help women navigate their health through clarity, confidence, and evidence-based information, through education, and also community reach outs like and events like this. So I'm super excited to be here and to have everyone here joined in. We are expecting many more people, but we can't wait for everyone to join in. This is about 17 minutes past 6. So we'll be starting now. Our speakers are here, and I'm sure they're excited to tell you about fibroid, have this conversation with you, and also share their experiences, their journey, their lessons to encourage every one of us here. Whether you are apparently living with fibroid, you have someone or know someone who has fibroid, or you just want to learn about women's health in general. I'm sure that you did not make a mistake by taking out time to join this webinar today. And I hope that we are able to learn here and get answers to all our questions. So it's very important for me to state that this is like a safe space where we can share our experiences. It's not a webinar. Tonight is not just about we coming to talk to you or the doctor coming to talk at you about fibroid. It's more of a conversation. And I noticed that from when I started creating content and interacting with women about their health, it was obvious that people weren't just, or women were just looking for information. Women needed answers. They wanted someone to explain things to them clearly. They wanted to know that they were not alone. And that was why I was very particular about bringing people who um, had the experience of having to go through the diagnosis of fibroid and even the management, and not just an expert who treats or manage women that have fibroid. So, and that's why tonight is not just any other webinar, it's a conversation. I hope I'm very audible. My voice is recovering from the stress of work. Can you still
Yes, we
hear
can
me?
hear you
Am I
clearly.
audible?
Yes,
Okay,
yes,
great,
yes, yes, I can hear you clearly.
great, great. Okay. So tonight is not just about fibroid alone. It's about you, about the women around you. Okay, okay. It's about the women around you, about you as a woman, and also about the goal is to create a safe space for honest conversation and evidence-based information, and to also encourage every woman out there. So no question is silly. Feel free to ask your questions when it's time to ask questions. If any question pops up in your mind as the conversation goes on, you can do well to put it in the chat box. And when it's time for question and answers, I would read out your question and would attend to them when the time is up and due. So, with further ado, I would like to bring up the first speaker. So, let me see. I want to open the chat. Okay. Let me share my screen. Okay. Can you see my screen?
Yeah,
Okay. So welcome to the Fibroid Conversation once again. I said welcome like thousands times now. I don't know how many times I've said it, but welcome again. So we're going to the all right. So we'll be inviting our first speaker for today in the person of Dr. Shakirat Smith Okono. She's a consultant obstetrician and gynecologist who is deeply passionate about improving the quality of care for women through education, empathy, and evidence-based medicine. She's a fellow of the West African College of Surgeons and National Postgraduate Medical College of Nigeria. Dr. Smith Okono has dedicated her career to ensuring that women receive comprehensive and compassionate care at every stage of life, from adolescent through to menopause. Our area of expertise includes fertility management, hormonal health, pregnancy care, and advanced gynecological procedures. Beyond the consulting room, Dr. Smith is respected speaker, educator, and advocate for women's health. She uses her platform. I don't know if you heard about the celebrity consultant. She's a celebrity consultant, and she uses social media platform or different platforms to demystify sensitive health issues, empower women with accurate information, promote preventive care, and our engaging and relatable approach has inspired thousands of women to take charge of their health. And she's known for her clinical excellence and genuine compassion to women's health. So, with further ado, please let's give a virtual clap to welcome our very own celebrity consultant in the person of Dr. Smith. I can't see the clap. Oh. Please, let's clap, let's clap, let's clap, let's clap. If we don't clap, she won't come up to speak. Okay, yes. I love the energy. Energy. Can you hear me? Am I still audible?
Yes, you're very audible.
Okay. Okay, welcome. Let me stop sharing my screen. Okay. Welcome, Dr. Smith. Okay. Um, all right. So how this conversation is going to be running is Dr. Smith, can you hear me?
Yes, I can.
Okay, good. Would like to see your face, so is it possible? Oh,
Yes.
oh, beautiful Dr. Smith. Okay, let me see. Let me try to pin. All right. Good evening, Ma. How is work going? I can see that seems like you are still at work.
We're always working, so
Life of being a doctor. So thank you so much, Ma, for joining us tonight and the willingness to also educate young women and give them the best information about fibroid. I know you are very passionate about women's health, and I also know that you've been very particular about fibroid and fertility, conversations around fibroids. I know there was a time that you were having this fibroid Sunday theme. Um, I don't know.
Sundays are for harvesting fibroids.
Yes, I hear. Sundays are for harvesting fibroid. I remember. So yes, so you can see that. Imagine having to harvest fibroid every Sunday, apart from other days. So it means like in this year now, you've harvested like how many times all the Sundays of this in the past 7 months? Okay, so I'll be asking questions from some of these questions have been from the Google form where people registered, and some are even from general questions that women have about fibroid. So rather than just coming to lecture, I wanted it to focus on questions where we'll be answering questions in the course of the question and answer. I'm sure that you'll be touching on. It's more like also presenting too, but this time it's more directed.
Yes.
So my first question is, what exactly are fibroids? Like, what's the cause? Gone, 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 gone. I'm sure that the women here want to hear it. What are these? We hear fibroid. What are they, and what exactly causes fibroid? About to you, ma.
Okay. Um, so I'm sure most people know what fibroids are. So I'll just try to explain in a very simplified way so that everybody understands where we're coming from. So you know that fibroids occur in the uterus, which is the womb, for a living person, So I don't want to use medical terms so that you will be on the same page with me. So we have the uterus or the womb, and it has muscles. So when you have any growth or any abnormal growth of that muscle, that's basically what fibroids are. So it's just and we call it benign. Benign means that it's not something that will lead to cancer. It's not cancer. So it's just a growth or swelling of the cells of the muscles of the uterus or the womb. Now, it's difficult to say what causes it, and that's just one annoying thing about it, because for you to prevent something, you should be able to identify that, oh, this is what causes it, this is what you should avoid so that, you don't have fibroids. But unfortunately, it doesn't work that way. So we know that fibroids are hormone influence, hormone stimulated, and that's why you find it in women. That's why you find it in women that are releasing those hormones that are responsible. And that's why you don't find fibroids in a girl that is 10. And a woman that's already in menopause, you won't have fibroids because those hormones are reduced. So anybody in the reproductive age group, so that's the age whereby you can give birth, are at risk of having fibroids. The exact cause we can't say, but we can say that there are certain things that increases the chances of somebody developing fibroids. And, if one knows this, you may be able to modify certain things. You may not be able to prevent it completely, but you may modify certain things in your lifestyle. So, for example, we always say that fibroids are more common in blacks, and unfortunately, there's nothing you can really do about it. You can't compare yourself to the whites because they are dealing with their own condition. But fibroid is a condition of blacks. There's nothing you can do about it. And so if you are black, you're at risk of having fibroids. The hormones that are produced by your ovaries, you need those hormones. So while the hormones are doing something good in your body, unfortunately for some, it increases the chances of one having fibroids. So saying that this and this and this are what causes fibroids, we have genetics. So some people are at risk. So once somebody's mother has fibroids, a sister has fibroids, there's that genetic tendency of her also having fibroids. Is there anything you can do about that? No. Even if you say, okay, fine, you're no longer my mother, you're no longer my sister, that's just by the mouth. Your genes are there, so one is at risk of having fibroids. So I personally don't really talk about causes of fibroids because there's really nothing you can do about it. Um, Evidence and science is yet to come out and say this is the exact cause. But they can say that yes, there are certain things that can increase the chances of one developing fibroids.
Thank you very much, ma.
You're
So, yeah.
welcome.
So for the um things that increases the risk of a woman, what are those risk factors? Like for a woman that's listening now that she knows that there's really no cause, what are the things that increases her chances? You
I would
mentioned
say that
age.
there's really no cause, so, because there's a cause. It's just that science is yet to pinpoint and say this is exactly what causes it. So obviously, for you to have fibroids, something brought about the fibroids. But
Mm,
science is yet to say this is the exact. So just give a couple of things that may, be responsible. So the risk factors, I think I tried saying some before. One, you being a woman and you having a womb, that's a risk
mm,
factor. So you can't find fibroids in men. Two, you being in a reproductive age group, and I said that earlier, you can't find fibroids in a girl that hasn't started her periods. You can't find fibroids in a 11, 12-year-old girl, even if she has started her periods. You can't develop fibroids if you're already menopausal. So once you're between ages of 30, 50, yes, that age group is at risk of having fibroids. We have some studies say vitamin D deficiency. So once one is deficient in vitamin D, there is an increased chance of one developing fibroids. And in those patients, yes, you can now decide to either treat the vitamin D deficiency, give them supplements to help to reduce the chances of fibroids, more fibroids developing or fibroids growing bigger than they should be. We talk about weights. So those on the big side, when one is on the big side, one also has a higher level of estrogen, because they're produced by the fat cells. And estrogen, like we know, are responsible for growth of the muscles, of the womb. They're responsible for increased, I don't want to use proliferation, but that's it, for its turnover. So for those who are obese, they have a higher level of estrogen. There's more stimulation for the womb, and so there's a high chance of them developing fibroids. Diet. Well, so we talk about diet because there are certain things that may put one at risk, you know. So people who eat less of vegetables, less of fruits, less of healthy things, and more of processed. And so that's why you keep hearing, oh, once I've had my fiber surgery, they said I should reduce eating my red meat, I should reduce eating processed food, I should reduce taking things that are inflammatory. Yes, that's where some of the risk factors come in. So those are like the main basic risk factors for one developing fibroids.
Thank you very much, ma. I hope we are learning, I hope we are noting these things down. The risk factors, and because we can identify these risk factors, it means that we can also reduce the risk and prevent it to the barest minimum as much as possible. So my second question is, why are fibroids common amongst Black women? Like, why is it that way? Why is it peculiar to our gene as being Black?
So um so we talk about vitamin D, okay? And vitamin D adds some benefits for improving the health of the uterus. Now, for Blacks, I'm not saying that this is the only reason. So one thing about studies is that studies will just say that, oh, we did a research and we noticed that, yes, this condition is more common in a certain group of people. Not necessarily that, oh, we know exactly why, but, this is what studies have shown. And so studies have shown that, yes, fibroids are more common in Blacks. And then when Blacks develop fibroids, they develop it at an earlier age. They develop it may be faster. They may have more fibroids. They have more symptoms. And then they have, what else? Larger size fibroids. And that's why most times in their abroad, they do not know how to do, I'm not saying they don't know how to do myomectomies, but, compared to we here, because we've seen and we've done bigger fibroids. So over there, they may say that, oh, this person has a 20-week size fibroid and they're offering her an hysterectomy. When we see patients with 36-week size fibroids and we can comfortably do myomectomies for them, hysterectomy is not, removal of the womb is not even on our plate, it's not even an option for us. So when for the Blacks, the skin, because of the high melanin content, there's a reduction in the way the body processes vitamin D, and that's where also that vitamin D came in. So we have a lower vitamin D level, and I already said that vitamin D is important for things within the uterus and all that. So when your vitamin D level is low, that's it. So that's one of the reasons or one of the causes or ways by which Blacks or reasons why Blacks have fibroids more than other people or other races. But for me, There's really nothing we can do about that. We are black, we are black. We cannot change that. So why does it cause it? Is there anything we can change about it? No, nothing.
Thank you very much, Ma, for your feedback. So my question still on the diagnosis will be that can a lady know, can someone have fibroid and not know? Is it possible for a woman to have fibroid and not know? Then what are
Many
the
people are.
symptoms that would be present to be able to even know if a woman has, I know some people, women have fibroids and don't have symptoms. But for a woman that even has fibroid and has symptoms, what are also those symptoms that she should pay attention to?
Okay, so to your first question, people have fibroids and do not know they have fibroids
Mm,
for two reasons. One, the fibroids are small and are not giving them symptoms. Two, because they do not know the symptoms to look out for. So there are two different things. They actually have symptoms, but they do not think that, oh, this symptom, or they don't think that this is a symptom. So they do not go to the hospital, and so they are not investigated or evaluated.
mm,
Many a times people go and do scans. So now most people are doing okay annual checkups, and that includes just doing a scan for no particular reason, just for routine checkup. And
mm,
then I've had a couple of patients that call me and they're crying that they did a scan and they are scared because the scan showed they have fibroids. And then
mm,
when you look at the fibroids, it's one fibroid, one tiny fibroid, that is really not significant. You know, so such a patient will not know she has fibroids except she does an investigation.
mm,
Now, for those who have symptoms, the symptoms are plenty, but most people know just the major symptoms. And thanks to social media and all that, there's now increased awareness. Everybody, if you go on TikTok or Instagram, somebody's talking about symptoms, somebody's talking about their experience. So now people are now better informed. People are now like, oh, okay, this person talked about this. This is not normal. Oh, I noticed that my bleeding is heavy, and somebody talked about it, and the doctor said it wasn't normal. So that means that it's not normal. So, most common symptom, abnormal bleeding. Okay, so most patients will have every menstrual bleeding. So
mm,
by every menstrual bleeding, we mean that they are bleeding in excess of what they should.
mm,
So normally your periods should last 2 to 7 days. When you see that your periods are going beyond 7 days, that's not normal. So it gets a bit worrisome when I see patients in clinic and they tell me that, oh, the period has been heavy for 2 years. And I'm wondering, 2 years, what have you been doing for 2 years? They did not know that it was a problem. Okay, so that's another issue that we have, this lack of information and lack of awareness. Now, if your periods even last 4 days, but now you're using more sanitary pads than before, maybe before you used to use 2 or 3 pads, and now you're using 7, 8 pads. That's abnormal. I'm now hearing people say that, oh, my bleeding is so heavy, so I'm using Pampers. That's not normal.
mm,
So the minute you see that your bleeding is in excess of what it should be, that's not normal. If you notice that every 1 hour you have to go and change, that's not normal. If you notice that even if you don't change, but you have to like double up, because if you use just one pad, your undies will get soaked, that's not normal. And there's something we call flooding. I had a patient come see me, and she was like, she went to the restroom and she just felt this gush of blood. It just came out like that. That cannot be normal. So
mm,
when you have these are symptoms of heavy menstrual bleeding, and it could be a symptom of fibroids. Okay. Now we have pain. Pain can be pain during your period. It can be pain in your abdomen at any point in time. It can be back pain depending on how big the fibroids are and where the fibroids are located. One can have pain during sex, or just pain that just comes out of the ordinary, you know. So most people are usually just focused on, oh, my period is not painful, but they have pain outside their period. That's not normal. So
mm,
any pain in your lower abdomen, now, some people would notice that there's something going in my tummy. When I touch my tummy is hard. Yes, it could be a fibroid. And in such cases, obviously, you need to go to the hospital. Now we have something that we call pressure symptoms. So pressure is weight. Now, fibroids and the womb may be small, but in cases where the fibroids are big, it begins to compress on organs and structures around. So you have the bladder in front, and when it presses on the bladder, some people may not have every menstrual bleeding, may not have pain, but their complaint could be that every time I go to pee, small comes out, but I still feel like there's something there, but it's not coming out. And that's because the womb is compressing on the bladder. You have some people that will say that, oh, every time I go, I feel like always pooing. But when I go to the toilet to poo, nothing comes out. But it feels like there's poo there, but it's not coming out. That's also pressure symptom. So those are like the very common symptoms of uterine fibroids. You can have others that are not very common. Some people will come with symptoms of anemia, but you can't have anemia if you didn't have heavy menstrual bleeding. So it means that they ignore that initial symptom, which is the symptom of heavy menstrual bleeding, and are now coming with a complication, which is anemia. And I'm seeing, as in the way I see patients, PCV 6%, PCV 5%, I'm like, ow, you know, how do they let it get to this stage? And that's because they don't know what is heavy menstrual bleeding. So they assume that this heavy bleeding they're having, not that bad, it's not that bad, but it really is that bad.
Mm-hmm.
So those are the most common symptoms.
Yeah. Thank you so much, Ma. So still touching on what you said about the
Okay.
back cell volume, there was a patient that actually presented with heavy menstrual bleeding of PCV of 6%. So I don't know if everyone knows what PCV is. PCV is like your blood level, and it should not, minimum should not be more than maybe 30 or 33.
Less than 30.
Yes. So imagine somebody presenting with 6%. It means that person has lost like how many points now?
More than half. She has almost
Like
lost all her
five,
blood.
like
She has
five.
almost lost all her blood. Yes.
Yes. So you've lost like 5 pints of blood. And she just didn't know. She just walked in and I was like, "Hmm, God is really holding you." Because imagine somebody walking in with 15% PCV, 6% PCV, and women don't know. A lady once told me that she did snipe pads they did. Is it not normal? So, like you mentioned, some people even have these symptoms, but don't know that they need to pay attention to it or even see a specialist as regards their symptoms because they've always lived with it and believe that that is normal. So I hope we are learning it's not normal. So if you know anyone having issues with heavy menstrual bleeding, before you say, "Oh, that's how my mommy and my sister or my auntie used to have heavy menstrual bleeding," please and please check well and be sure that there's nothing, you know, going on before you now conclude. So, we've touched on symptoms. Still talking on symptom, also wanted to ask. There was a question in one of the participants asked on the Google form as regards symptoms. Why do women look pregnant when they have fibroid? I know you've talked about the pressure symptoms and the abdominal swelling, but I just wanted you to just touch on it quickly before we move
Okay.
to
So,
fibroid and fertility.
okay. So when a woman is pregnant, the uterus is enlarged with a baby. So fibroids grow on the womb. So whether it's on the womb or inside the womb, fibroids grow on the womb. So depending on the number and the size, the womb gets bigger, and so she looks like somebody that is pregnant. And that's why even when we are trying to describe the size of the uterus, I think I tried saying it earlier. You say 14-week size, 20-week size, and those are the terminologies we use when we are measuring the uteruses when people are pregnant. So she will look pregnant because her womb is enlarged with a mass. This time around, it's not a baby, but it's enlarged with masses that are fibroids.
Thank you very much, Ma. So moving to fibroid and fertility, which is one of the biggest concern that majority of women have, in Nigeria, a lot of women want to have children, or even those that are not probably willing to. Society is already asking, for a couple that just got married. Next thing now, where is the baby and all that? So, fertility is one very important conversation in our society, and that's why I wanted us to touch on this. So, as regards fertility, so how does fibroid or how do fibroids affect fertility or pregnancy outcome in women?
Okay, so first of all, when they ask where is the baby, the answer should be baby is coming. Abina. So um fibroids and fertility, it would surprise you to know that fibroids is not one of the leading causes of infertility. So you have people with fibroids and they get pregnant easily. So, it's not like number one where you say PCOS, not ovulating, or blocked tubes and all that. Fibroids are there, but it's not very common. And
Mm.
I think what we deal with now more is pregnancy complications due to being pregnant with fibroids than infertility due to fibroids. I hope I didn't just confuse everybody there. So, but in cases, and that's why most times when somebody has fibroids, we do not just rush to say let's go and remove the fibroids. No, because you can actually get pregnant, you know. So we would evaluate you for all the other causes of infertility and try and get you pregnant. It's not if, despite everything, you don't get pregnant, that we can now consider that, oh, okay, maybe it could be the fibroids, and then we try to take out the fibroids. Now, um, but in some cases, yes, depending on where the fibroids are and the size of the fibroids, they may cause infertility. So if you have fibroids blocking the tubes, obviously, that person cannot get pregnant because the tube is like a bridge connecting the sperm and the egg. So if you have a fibroid, except life is very unfair for that person, you have two tubes. So it's very unlikely that you have fibroids blocking both tubes. But then again, such is life, it can happen. So if you have fibroids blocking the entrance into the tube, yes, so it could cause a mechanical obstruction and prevent the egg and the sperm from meeting. So also, if you have fibroids over the cervix, you know, so it prevents the sperms from entering into the uterus to get to the baby. Yes, that can cause infertility. Now, in cases whereby you have big, huge fibroids that your abdomen looks like you're 9 months pregnant, the way this will prevent one from getting pregnant is, normally the uterus is small. It's not even, it's like a fist. So imagine something that is as big as a 9 month old baby, and you want the sperm to travel all the way up to get to the tubes. So usually, most times the sperms would have died before they even get to where they want to go to. That's if the uterus is very, very, very big. But then again, I've seen and I've managed patients with very huge fibroids and are pregnant, you know. So like I said, yeah, so thank you for that, you know. So so these are the different locations of fibroids. So those fibroids, the submucosal fibroids, the ones that are inside, they can cause infertility because if the baby should land on this fibroid cannot give the baby any nutrients. It can't give the baby anything. So what happens? There's nothing, there's no supply, no nutrient to that fetus. So it's not going to grow, it's going to die. So those are some of the ways that fibroids cause infertility. Now, what is more important now is if I have fibroids, should I remove it before I try getting pregnant, or I should get pregnant with the fibroids? And I think that will determine that will depend on the size of the fibroids. So recently, last week, I operated a woman with fibroids. I delivered a baby. The baby, she had fibroids in the lower parts, over the, I won't say directly over the cervix, but in the lower parts. And she had everywhere up. In fact, everywhere, huge fibroids. And the baby was in between the fibroids. And will you believe that even after delivering that baby, that womb was the same way? That shows you how big and how huge those fibroids were.
Mm,
And I had to tell her that she has to have a fibroid surgery before she gets pregnant again
mm,
because she was just very, very,. You know. So when people get pregnant with fibroids, there are a couple of complications that may occur. It doesn't happen all the time. And that's why we don't tell everybody that has fibroids to remove their fibroids before getting pregnant. No, because you might be lucky and not have complications. You may be lucky that your complications are not that severe. There are things that you can manage. So some of the complications are one, miscarriage. So when you have fibroid, like I said, when you have fibroids inside where the baby stays, and the baby implants or the baby attaches to this fibroid, that pregnancy cannot grow, that pregnancy cannot continue. Do you understand? Because the baby is not getting nutrients.
mhm,
So one may do a pregnancy test that's positive, and then after a while, one starts to bleed, and then that's the end of the pregnancy. You can also have fibroids that are all over in the uterus, in the muscle, everywhere. And that may also, you know, it irritates the uterus and one starts having contractions. And that
mm,
can also cause a miscarriage. So if one is lucky not to have a miscarriage, one may have pain. So as the womb gets bigger, it's taking more nutrients to the baby. So that's why people always say, oh, the fibroids and the baby are competing for blood supply. So there may be reduced blood flow to the fibroids, and so some of the fibroids may die off and cause severe pains. So
mm,
there are people that have fibroids in pregnancy that come, back and forth with recurrent pain. Today is pain here, tomorrow is pain there. Yes. Now, depending on where the fibroids may prevent the babies from lying properly. So, I mean, I do think you can show a diagram of longitudinal lie and all that.
okay.
So if the baby is supposed to lie straight down, but there's a fibroid pushing the head to the side, so the baby is now lying across or, this way, diagonal. And so that baby cannot come out vaginally. So it ends up requiring a cesarean section. Depending on how many fibroids and how big the fibroids are, there are cases whereby women fall into labor before 9 months. 7 months. So 7 months, we won't call it a miscarriage. So we call it preterm labor or preterm delivery. So why does this happen? If the uterus is very big, and so you see it in cases whereby uterus is very big, either there's plenty water inside, the baby is very big, or you have fibroids, or you're carrying twins, or more than that. So when the uterus is very big, it tells your brain that this uterus has reached the size that it should be. So it is time for you to start, contracting to bring out the baby. Doesn't necessarily mean that the baby is 9 months. And that's why patients with fibroids, they can just see water before time or start contracting and then deliver the baby. So we call that preterm labor, which is something that can happen. Then you can also have, so I've said it, increased operative intervention. So increased risk of a cesarean section. Because if the fibroids are lying down, where the baby is supposed to pass, baby cannot pass. So what happens? You need to have a cesarean section to bring out the baby. Because the uterus is also very big, with the fibroids, it does not contract as it should. And we know that after baby comes out and placenta comes out, the uterus contracts, closes off those blood vessels, where the placenta that was supplying the placenta to stop bleeding. But
Mm,
at times with fibroids, this does not happen, and the woman continues to bleed after delivery, and that's what we call postpartum hemorrhage. We've heard of patients that they did CS, they removed fibroids, and sepsis occurred and all that. Yes, and that's why we try not to touch fibroids when we're doing a cesarean section. So these are some of the things that may occur in patients who have fibroids. And so I always advise my patients. So when I see a patient with fibroid trying to get pregnant, I would highlight, so these are the things that can happen. If we do surgery, these are the risks that may happen. And unfortunately, the truth is that even doing a fibroid surgery comes with complications. Tubes can get blocked. I'm sure you've seen online some people say, "Oh, I did a fibroid surgery and I have not seen my period. My period has not come since then." Yes, this is one complication that may occur depending on techniques and all that. But irrespective of whatever it is, it's a complication that occurs. And that's why most times we would prefer that you try to get pregnant. Let's see whether you have issues during pregnancy. Are you able to deliver safely? If there are now complications from them, then we can now say, you know what, we have to do a fibroid surgery for you. But otherwise, fibroid surgery is not usually our number one it's not our number one option, And most times, once you've done a fibroid surgery, all your subsequent deliveries will be by cesarean section. So we feel like it's a bit safer. Let's see how you are able to deal with fibroids and pregnancy first. Who knows? You may not have any complication. Who knows? You may have complication, and then we'll now decide what we want to do after that.
Well, thank you so very much. So I really like how you explained it and tried to provide clarity as regards fibroid, because a lot of women believe that fibroid is, or she having fibroid is the reason why she has not gotten pregnant. There was a patient that I think I saw last week Monday, and by the time she did scan, she had fibroid. However, the fibroid was not even within the lining of the womb. The issue or the cause of the infertility that she was experiencing was more of the partner's side. It was more as regards the partner's SFA. But she was still worried. She was like, what drug has she used? What drug has she used? And I just had to reassure her that this fibroid that you have, because she had heard a lot of things. If you have fibroid, you don't get pregnant, or if you have this, you. So she had soaked in those information and assumed that that was the reason why she wasn't getting pregnant, not knowing that the main problem she had was even that what was from her partner, not necessarily because she had fibroid. So I hope um everyone here is able to follow, listen, and get answers to your questions. And if you are still not clear, please you can drop your questions in the chat box so that when it's time for question and answers, I will just chip it in again and she can expand it. So please and please, you can even drop it now. If it's still in line with what we're saying, I'll just add on to what I've asked, and she'll just buttress on it. But it's very important that we know that fibroid is not necessarily a primary cause of infertility, as she has mentioned. It's just depending on the size and the different locations, which is what I was trying to share from the picture I shared. So thank you very much.
So I mean, can you quickly show the picture with the different locations, position of fibroids?
Okay. Let me share my screen. I was even also trying to show the one that had the fibroid with baby inside of it. A bit the uterus with baby. Okay, so let me share. Okay.
Okay. Can you help me enlarge it? Okay, so let me see. So basically, when we talk about position of fibroids, we're really mainly interested in three. We have submucous, which is inside. Okay. So you can see that this is There are different types of submucous. You can see a pedunculated submucous. That is clearly everything is inside the uterine cavity and it has a stalk, so it's like a mushroom. It has a stalk. So that's a pedunculated submucosal. You can see this other submucosal. It's not completely inside the cavity, but you see that it's inside the wall of the uterus, but it's pushing inside the cavity. So these submucosal fibers, they usually cause heavy menstrual bleeding. They hardly cause pressure symptoms, but they usually cause heavy menstrual bleeding. And the uterus is usually not that big. Now you can see this other one, intramural fibroids, purely inside the muscle of the uterus. That one too can also cause heavy menstrual bleeding. Now, this subserosal one, so you can see this subserosal one is inside the muscle, okay, but is also pushing outside. You can see that it's a bit different from that fundal subserosal. That one is almost purely um subserosal. Okay, it's almost purely on top of the uterus. These are the ones that usually cause pressure symptoms. And I forgot to mention one pressure symptom. So when somebody has fibroids, we don't just do a pelvic scan, depending. Once we see that the uterus is about 5 months pregnant, we have to do an abdominal pelvic scan
Mm.
because now the uterus is big enough, can begin to compress the ureter. So we are looking at the kidneys, making sure that there's no backflow of urine. So even if the patient does not have pain, does not have heavy menstrual bleeding, does not have any symptom, but a scan is showing that she has hydronephrosis, which is that water is beginning to accumulate inside the kidneys, we are going to remove that fibroid. Why? Because she has pressure symptom, which is a symptom. And if it persists, one is going to damage those kidneys. So you can't just say that, oh, I noticed this swelling. I know that there's something odd inside my tummy, but it's not giving me pain. My bleeding is not abnormal. And so you sit at home. No, it's not your call to make. Okay. So I think that's what I wanted to say about the location of fibroid. I saw a patient today. She'd been having this vaginal discharge, vaginal discharge, vaginal discharge, and just this abnormal bleeding. She had gone to an hospital in January. They tried to do a vaginal examination. As they wanted to put the speculum, she started bleeding, and so they abandoned the procedure. Please, this should never happen. So we put a speculum. Speculum could not enter initially. So we put our fingers, and guess what? She has a prolapsed submucosal fibroid. So you can see this fibroid here, this pedunculated submucosal fibroid. For her, it had come out of the cervix into the vagina, you know. So, and it was huge. It was big. It's like two of this submucosal fibroid. That's how huge and big it was. And I see a lot of that lately. Not because of anything, but what happens is when you have a big fibroid inside the cavity, the weight is much, and so it begins to come out, come out, come out of the cervix. At times, I even feel like most patients should have that kind of fibroid because you don't have to cut them from inside. All you have to do is you just go from inside, whether you're going to twist it or you're going to cut it and surgery over. So that would have been the best surgery for her. But unfortunately, she also had fibroids, the other fibroids. So her abdomen looked like she was 5 months pregnant. So she's going to have a combined surgery. I remember when I was doing residency, I know that most patients, when they come to see the gynae and you want to do a vaginal examination, they're like, no, why this? My problem is in my tummy. Why are you looking at my vagina? And seriously, at times, some doctors don't even have so much time. Yeah, so that's it. Can you see that? Yes. So it had prolapsed and it was coming out of her vagina. Yeah. So if a doctor wants to do something for you and you say no, you know what they will just do now? They'll just document patient refused and move on. So this patient, this was very sad. This patient had an abdominal myomectomy somewhere,
Mm.
but a vaginal examination was not done for her.
Wow.
So imagine doing a abdominal myomectomy, and weeks later, we have to do a vaginal fibroid polypectomy.
Hmm.
because the vaginal examination was not done. So they missed this pedunculated submucosal fibroid in the vagina.
Wow. Wow.
So I feel like, um, well, it shouldn't be an oversight because not that's not the kind of thing that you should forget to do. But that's the whole idea of why we're educating. And that's one thing I always preach to my patients. I will teach you, I will explain to you so that you know. I may be your doctor today, but something may happen. You may go to another hospital, you may relocate, but you have the information. So if somebody else comes and is telling you something different from what I've said, at least you understand, you can ask questions. And then, maybe the doctor was not thinking in that light, but then your questions may not prompt him to actually think in that manner. And then he's like, oh, okay, that's true. That's true. You're actually right. Some doctors will actually own up if they're wrong, or if there was an oversight or something. So please, you cannot go for a surgery, okay, before a surgery without a vaginal examination being done for you. No, it's must. It's a must. It's a must. It must be done for you, please.
Hmm.
Okay, I'm there.
Thank you so very much, Ma.
You're welcome.
Yes, so I hope we are learning, we are taking notes, and we are also getting answers to the questions that we had or we have. So, yeah, the importance of knowing these things, not necessarily even for now, it could even be for when you present to the hospital, so that in situations where you feel like some interventions were not done, maybe even an examination, a vaginal examination, you can also state it. Oh, doctor, are you going to do a vaginal examination? Is this going to be done? And be sure that all the boxes have been ticked before getting the required treatments that you need. So thank you very much, Ma, for answering those questions. So I want us to move fast as to the treatment. We talked about fibroid and fertility. Now I want us to move to the treatment, which is one very big thing. Like in one of my videos, there's really no time I've entered these big bosses that, or I don't hear people talking about fibroid. In fact, what amazes me is how that the same products that would melt or shrink fibroid is the same product that will treat erectile dysfunction. And I'm always just confused. So a lot of women are using different things. I was still going to touch on that when Madam Kikelomo comes on board to talk about her experiences with concerning delaying treatment. So, but I want you to just touch on fibroid and their treatment. Do all fibroid need surgery? And people also always ask, what are the treatment options when it comes to fibroid? A lot of people hear, I have to remove my womb, I have to do this, I have to do that. People just think once they hear fibroid, the next thing is surgery. So do all fibroid need surgery? And at what point is surgery even recommended?
Okay, so this is a very wide topic, and if I start, I will not finish. But there's something I always preach on my page, and I always say is not every fibroid requires surgery. So you cannot have a fibroid that is like a seed. It's not giving you symptoms, and you want to operate it. No, there are indications for fibroid surgery. I like to say here now that the definitive treatment for fibroid is removal of the womb. We
Mm,
know that fibroids grow in the muscle of the womb. You understand? And so, as long as it's there, fibroids will continue to grow.
mhm,
So, for a woman that does not want to have fibroids, the treatment is surgery. And the surgical treatment is removal of the womb. But you can't remove the womb for somebody that's trying to get pregnant. And that's where the differentiation comes in. So for somebody who has completed a family size, she does not want to get pregnant again. She's sure she's not going to regret it because we haven't started doing uterine transplants, and she has symptoms. The best treatment for her is removal of the womb. Now, for those that don't, so that way she can never, ever, ever have fibroids again. So that's that. Now, for those who don't want to remove their womb, That's when we now have conservative management, and that will now depend on what your symptoms are. So for somebody that does not have symptoms, our fibroids are small, they're not disturbing, and what we do for such a patient is what we call expectant or watchful waiting. We're just observing. So we can say every 6 months, you know, we would repeat your scan just to monitor the growth of the fibroids, see if new fibroids are growing, see if they're getting bigger. Basically, that's it. Now, for those that have symptoms, it now depends on what your symptoms are. At times, for those that have heavy menstrual bleeding, we can decide to give a drug that helps to reduce the bleeding during your period. So some may say, I only bleed heavily on the second day of my period. After that, I'm fine. So such a case, if the drug reduces your bleeding, so it's not a big deal. So we could do that for you, and that is what your treatment option will be. For those who say that, oh, mine is just pain. First 3 days are very, very painful. I can't go to work. So no problem. Because surgery has its own risks and complications. And I always say it's a risk benefit ratio. So the benefit of doing that surgery must exceed whatever risk or complications that would occur from that surgery. So for somebody who has pain, and that's the only symptom, fibroids are not big, it's just the pain. Then we give painkillers, that she takes during a period. There are other hormonal medications that we can use, but there are indications and reasons for them. So these are not things that anybody online can tell you. No, these are things that you are going to have a conversation with your gynecologist
Mm.
based on your history, based on your desire, based on your other conditions that you have. Then they will now identify what treatment option is best for you. There are some people that we do what we call endometrial ablation. They don't want to get pregnant, but they don't want surgery. So no problem. Oh, no, let me not say they don't want surgery. They don't want a myomectomy. They don't want an hysterectomy, but they're not interested in getting pregnant. So, but they're having heavy menstrual bleeding. So we can decide to burn off the lining of the womb so that they will not menstruate. So they have their uterus. But does that solve a problem? Well, if our problem is only heavy menstrual bleeding, yes. But that does not mean that tomorrow she cannot develop pain. So we have only solved our current problem. We have not prevented future problems. Can the fibroids continue to grow? Yes, because we do not do anything about the fibroids. So the fibroids are still there, you know. And then I think I've said the surgical. Now, there's what we call minimally invasive surgeries. So I don't know if you've heard of what's it called? Uterine artery embolization. I know a couple of patients have asked me about it, but I personally do not recommend such for somebody that may still want to get pregnant. You know, that's not my recommendation, because one way or the other, there might be complications to the ovaries. So for somebody that still wants to get pregnant, you don't joke with her ovaries, you don't joke with her eggs.
Mm.
So that's not usually my recommendation, but just in case you decide to ask, it's there, it's an option, but it's not usually my recommendation. There's something that they call using ultrasound frequency to try to melt the fibroids. The thing about this is that it's not an immediate fix. You do it, and over a period of time, the fibroids begin to reduce. So for someone that has an acute problem that is bleeding heavily every single month, that's not the best treatment option for them, because you have to keep waiting for eventually for the fibroids to actually, reduce significantly. And in the long run, maybe you've helped, but in that immediate, you've not actually helped the patient. So the options are conversations that you have with your doctor, not online. There is no there is no medication that can shrink fibroids. We have medications that we give that can reduce the size of the fibroids, but the drawback of it is that it's not something that you can use forever. The minute you stop that medication, the fibroids will grow back. And I really need people to understand, because every time I open TikTok, I see people mixing concussions in their backyard, and then you check the comment section and you hear people saying, how much, how much, how much? And I'm wondering, somebody is mixing concussion in our backyard and you actually want to put that thing into your system. You have no idea what it is. Somebody has told you that it will shrink your fibroids and you actually believe so, you know.
Mm.
So you're damaging your kidney in the process, you're damaging your liver in the process. But if I have to be very, very, very sincere, during residency, I had one patient. She'd had two previous CS before, and she was resource negative. So getting blood for her was always difficult. And she had fibroids, and her symptoms were heavy menstrual bleeding. So we're planning her for a myomectomy. So what we're trying to do was to get her blood type and build up. And then she just disappeared. I didn't see her again in clinic. And one day she comes to clinic and I examine. And to be very honest, I did not feel the fibroids. Usually, when I used to examine her, she looked like she was 5 months pregnant, but I did not feel the fibroids. I called my colleagues to come and examine. We did not feel the fibroids. And I was like, what did you use? She said she got something, and that's what she has been using. And well, I didn't know better then. And I'm like, okay, no problem. As you have found solution to your problem, you have saved yourself surgery, finding blood, not an issue. She came back 1 year later and she looked like she was 7 months pregnant. And I was confused because it just did not make sense. And I was like, what about that thing you were using that made your fibroids disappear? She said she couldn't find the vendor again. And that's usually the thing. If you're taking something that's actually suppresses your fibroids, lucky you. Do you understand? But I can almost guarantee and promise you that the minute you stop that thing, your fibroids are going to grow back and they're going to grow faster. So we have a medication that we use to try to reduce or shrink the fibroids. But usually we can't use it for more than 6 months to 1 year, because what it does is that it shuts down the ovaries. So when we use that medication, we are pushing that patient into menopause. So we are solving one problem, but creating another problem, early menopause. And early menopause has its own risk and side effects. Now, like I said, we can't use that medication for more than 6 months or 12 months, meaning that after 12 months, you stop the medication. So what happens? The ovaries start working again, the ovaries start to produce the hormones again, and what happens? The fibroids grow back. So when we use it for specific reasons. This person, her abdomen looks like she's 9 months pregnant. She's going to bleed. Her blood type is rare. You want to try to conserve her bleeding or conserve blood loss. So you want to reduce the fibroids a bit so that she doesn't lose so much blood during her surgery. You have some patients that you have to cut them from their pubic symphysis all the way to their chest. Do you understand? Because the fibers are big, but the patient doesn't want that. She wants the cut just to stay under her navel. No problem. We can try the medication, let it reduce the fibroid to a significant size, and then you go in for your surgery. Do you understand? But the problem with that is that those other fibroids that you have shrunk, that you did not remove because you could not see, once you stop that medication after the surgery, what happens? Those fibroids will grow back. So that's why some gynecologists, I in particular, I rather prepare for blood loss, do everything I can do to reduce your bleeding, get enough blood, get enough products, than for me to do a myomectomy for you, and then some months later, you go and do a scan, and scan is now showing that your fibroids are back. Your fibroids are not actually back, but your fibroids they were never removed in the first place. So they were there patiently waiting. So basically, that's it. I don't know if I missed anything out, but so those are the treatment options. So it depends on your age, depends on your symptoms, depends on your size of fibroids, it depends on where your fibroids are, it
Mm.
depends on what you want. Are you trying to get pregnant or you don't want to get pregnant? So that will determine the exact treatment option for you.
Thank you very much, Ma, for that. So I there was even a part that I wanted to shout, increase mic, increase increase the volume. Yes, so a lot of people believe that different mixture would shrink fibroid or even make the fibroids disappear. And I hope that we've gotten clarity as regards medications and reducing the size. Some of these medications are used in preparation for surgery and not for long-term management. So, and I also learned that some vitamins even help. Like you mentioned, risk factors like vitamin D. I've learned that even this vitamin D also reduces the chances of the fibroids increasing in size and not even necessarily reducing it, just to prevent it from
Me, me, me,
increasing.
me, me, me,
May,
me,
okay,
me,
may, mhm,
me.
may prevent it from increasing in
So
size.
that everybody will not go and start buying vitamin D now and saying that their fibers do not reduce.
Okay. Thank you very much, Ma, for that. So, I'll be moving straight to the um panel session. Dr. Smith, I'll still like you to be around because of the questions. There are quite a number of questions in the chat box, but because of time, and they've been around from the very beginning, I'd like us to move to the panel session to be able to hear these people speak. These are people that have lived the realities of fibroids. Um, someone that we have four different individuals. I've still not seen one. I know two. Let me see. Miss Susan around. Susan, are you on the call? I don't know if Susan is around. I know Miss Kike Lemo is here and Miss Oluwafumila is here. But while we wait for others, and because of time, I would like us to go to the panel session. Me on pin.
Yes, ma'am, here, ma'am.
Oh, okay, great. Thank you very much. So, Miss Kike Lemo, Miss Fumlayo, let me try to pin your chat so that we can have the conversation. And Fumlayo. Okay. So thank you very much. Once again, I want to first of all thank you for deciding to do this. It takes a lot of courage and vulnerability to come and willingly share your stories and your experiences with fibroid. And I honestly appreciate that. So we have the last person, I'm not sure she's around. Mrs. Oman Kalem. Are you on the call? I'm not sure she's around. She's the lady who had two children after fibroid diagnosis and fibroid treatments. Okay, so I'll just continue with women that are here. Okay, so let me share their screen just to quickly read through their experiences, individual stories. Mm, oh, so share my screen. Give me some minutes. Okay, so we have Susan Gibsoni, who for years she thought heavy menstrual bleeding was simply something she had to endure. Just like Dr. Smith had mentioned, some people who have these symptoms but don't necessarily even know that is a sign to a particular condition. And months after months, the bleeding became heavier, fatigue became worse, and everyday life became more difficult. Eventually, she presented to the hospital, discovered that she had fibroid, and even her blood levels were low, that eventually required blood transfusion. And today, she continues to live with fibroid while balancing work, life, and the challenges that come with the condition. Her journey is really one of resilience, learning, and refusing to let fibroid define her. And I'm sure that in this conversation today, she would love to share what she really feels like to live with fibroids, the lesson that she has learned from her journey, and to what she wishes every woman here knew before he got this far. So, Susan, can you just say hi to all the women that are very excited to hear from you?
Hi everyone.
Hi, hi.
Good evening.
Good evening. Welcome. Welcome on board.
Thank you.
Thank you for joining. So I'll move to, let me read. Okay. So the next is, what's going on? Who's writing on my screen? Thank you very much, Mrs. Omolara, for for showing us that you are here. Please try as much as possible not to walk right on the screen. Thank you. Okay, so Mrs. Oluwafunmilayo Adenuga, um, so our story is that of from fear to freedom. When she started having heavy periods, it started gradually, and over time, it continued, became bleeding for long hours, 7 days to 2 weeks continuous. And eventually, she got the diagnosis and she was worried, she was scared. Oh, because when she was growing up, she heard that, oh, a lot of people die from fibroid. And that's still one question I would like Dr. Smith to answer. You know, we've heard stories of women that, oh, she just went to do surgery or fibroid surgery, and that was what happened. And, she did not make it again. A lot of these things are out there, and people are scared. Should I go for the surgery? And that was the same reality that Miss Oluwafunlayo faced. But her bleeding continued. She needed blood transfusion and eventually resorted to having a surgery. And now she's grateful for it because after the surgery, things have gotten easier and her quality of life has also improved. And I'm excited that she's going to be here. She has been looking forward to this time, and I'm happy to have her on board to talk about our experience and share our journey from moving from fear of uncertainty to healing and that of hope. Then our next speaker is Miss Oman Kalem. She's not on the call yet, but I hope that she joins us before the end of the conversation. She moved from fear to also motherhood, where she was diagnosed with fibroid, and she kept pondering on the question, will I have children? Will I have children? But from further conversations with the consultants, with the doctors, things began to change. And even from the experiences that she had from a friend of ours that also had the surgery done, she was encouraged to do her surgery. And eventually, today, she's a proud mother of two beautiful children. And she'll be excited to share her journey in this conversation. And the very last but not the least is Miss Jimokike Lomo, who moved from delay to treatment. So when she was first diagnosed of fibroid, she didn't want to hear anything about surgery. She was like, no, 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 no. Just like every other woman, surgery will want to be the last thing. A lot of women are very scared when they hear surgery. She tried a lot of herbal medications just to avoid surgery as much as possible. But eventually, after conversations with the doctors and encouragement, she decided to have her surgery, and she's doing very well, recovering excellently well following the surgery. So, without further ado, please, the virtual clap. Let's welcome our panelists. Let's welcome them. Please clap, 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 clap now. I cannot see the reactions. Oh. Let me stop sharing at a second. Where is the virtual clap? Please now. It's not easy to come and share experiences and journey. Thank you, thank you, thank you, thank you. Thank you. Ah, in fact, wow, thank you so much. So I'll be starting with Susan. So Susan, how did you feel when you got the diagnosis of fibroid? How did you feel when you, first of all, discovered that, oh, this heavy menstrual bleeding that I've always had was as a result of fibroid? And how did it affect your everyday life?
Okay. Good evening everyone.
Good
Hope
evening.
everyone is okay. Okay, when I first got diagnosed about my condition, I actually didn't take it too hard.
I've already put the baby on insurance.
Like it was something I should worry about. too much because it wasn't a case of concern for me, really. So, and all I had to do was go for monthly checkups to see how I'm doing. Hello?
I'm listening.
Okay. So all I had to do was go for monthly checkups and get drugs for my pain, my abdominal pain that I usually get during my monthly cycles. And that was it. And ever since then, I've been okay living with it, no complications or anything. I've never really paid attention to it. Exactly. That's all I have to say for now. Until recently, when it's beginning to become a concern, a case of concern where I have to, come to the hospital, get some blood works and fusions until just recently. So, yeah, I don't think it's something to be completely scared of,
Mm.
if you ask me. Yeah, because there are measures to take to reduce certain pain and bleedings. And for my case, it's always been a case of heavy bleeding. So I've always taken it as it's a normalcy, like okay, if after certain amount of time I stop bleeding, then that's fine. So it hasn't really been a serious case for me,
Mm.
though.
Thank you very much, Susan. Thank you for sharing your experience.
Thank you.
Yeah. So my next question will go to um Miss Oluwafunmilayo. Yes. So I know you shared your fear as regards what you had heard about fibroid while you were growing up, especially when you got the diagnosis of fibroid, if you know the different stories. I hope I won't die. I hope I'll be able to have children and all. So I want you to just quickly touch on some of those fears and what made you eventually decide to receive treatment and have the surgery done. Miss Funlayo.
Yes.
Yeah.
Hi, can you hear me?
Yes. Loud
Okay,
and clear.
so hi everybody, good evening. My name
Mhm.
is Ola from Layo. You said they think how I overcame the fear, right?
Yeah.
So I think at some point I was just done having, to bleed every month, heavily. I mean, the first 2 days of my period, I would not be able to go out. If I'm leaving my house, I need to, look after myself like a million times. I'm very conscious. I can't see it. It was too much. I could not bear it anymore. I was just done, and I was just like, "Ugh." I think that even getting this out will be better than living with this.
Mm,
And another thing that helped me with the fear was really having a very good doctor. Because
mm,
I remember that if, every time I go in to speak with her, she would enlighten me. Laid my words, like explain it to me like I'm 5 years old.
mm,
She would draw whatever what exactly is happening, and it just gave me confidence, and also really looking at other people's story because I was very nervous. And I'm like, okay, let me and especially when I heard that this is something that affects a lot of Black women, and it's so common that we know, more than we know. I went on TikTok. I would watch vlogs of people. I've seen a lot of people, do the surgery, and they are very much alive, living their best lives. I'm like, okay, I think this is not as bad as I have it in mind, because to be very honest, growing up, I'll just it's not necessarily but it's just discussions with my parents and maybe their friends. Oh, this person died from fibroids. Oh, this person was diagnosed with fibroids, and they are very scared to go for the surgery because they can die. And I'm like, so you mean that fibroids that I heard when I was growing up is what is happening to me?
mm,
What do you mean? So my fear was like over the roof. I remember the first time that I found out that I had fibroids. I was that the whole day I just kept wondering, like, what do you mean? How old
mm,
am I? What do you mean I have fibroids? Like, what's going on? I was really scared. I couldn't tell my mom for the longest time because I was like, what's happening? But then I feel like what really helped me the most that made me overcome the fear was having a very good doctor, because I cannot overemphasize how that's really helped me. Like, and even when we found out that the only option for me was to actually get it out, she still did not make it look like it was such a big deal. It felt like something very normal. The conversation was very great, and that just really boosted me. And I was just like, nah. And the fact that I was just done with having to bleed heavily like that. I mean, I never used to bleed like that. I was someone that did my period for, let's say, 4 days, but I just noticed that increased from 4 days to 6 days to 7 days. Then at some point it was 2 weeks, and the first 2 days, like I mentioned, would very heavy. I
Mm.
ate I never looked forward to seeing my period. I hated that period of my life. And every 28 days, I'm already bleeding for 14 days. Before I blink my eye, it's already here again. I was just like, so I was just really over it. So I feel like the fact that I was very frustrated and so done with it just made the fear, very little.
Wow. Wow. Thank you so much for sharing. Thank you so much. So the importance of having conversation with the right set of people. And I'm grateful that you were able to meet with, you didn't just rely on um what you had heard or the things that people say, but you took the courage to go to the hospital and listen to a doctor. And which is why I want to encourage everyone here. Yes, we hear different things about fibroid, just like the way Olafunlayo had heard things about fibroid. Oh, this person died. But I also want to mention that there are many women that have fibroid surgeries that are doing very, very well. So, like I shared with one of my patients that sometimes some of the causes of death in these people are not necessarily because they even had the fibroid surgery done. It could have been as a result of other things that were associated or surrounding their medical condition. So you should not use case A to judge case B. It doesn't mean complications cannot happen, but it doesn't mean that you should, put the complications first before even your treatment. So thank you very much. And it's very important to also have conversations with a doctor, an expert in that field. See a gynecologist, have conversations, ask questions, and that's why you're also here to ask questions and get clarity. So thank you so much for me for sharing your experience. And I'm sure that this your experience will also encourage other people, like the way you heard the stories of other women that have done the surgery and are doing very well, other women to also make decision concerning their treatment. So before I ask you another question, I would like to go to Mrs. Jimo. Mrs. Jimo has also had the surgery done for fibroid before, but as was the story of delay. Miss Jimo, can you hear me? Can you try to unmute?
Can,
Okay, okay, I can hear
hello,
you.
can you hear me now?
Yes, I can hear you.
Okay.
So my question would
Um,
be, before you eventually took decision to do the surgery, why did you delay? And what alternative did you try before eventually, having the surgery done?
okay. Good evening, everybody.
Good
I'm
evening.
happy to be here with you all. I'm just happy to share my experience with you guys. So the journey started 2022. Yes, when I lie down, I noticed I always feel a lump at the lower part of my belly. I was like, what is this? So and I went to the health center to check. Then they said it was, and then I was directed to the lab to go for pelvic scan. Then that's when they told me it was fibroid. So immediately it was herbal medicine that comes to my mind. Hello, can you hear me?
Yes, I can.
Hello. Okay. So it was the herbal medicine. So immediately I told my brothers about it. So immediately I started using herbal medicine. Initially I just thought it was not a big deal. Not a big deal. But when it started getting bigger, that's when the fear came. The fear started. So I was, my brother called a man, said that he deals with herbal medicine. So he said when I use his product, that the thing will melt it out and everything will just come out. So I was there for 3 days. I went there. So he gave me all sorts of things. In fact, there was one he gave me. He said it is mixed with like the cow's urine. He mixed some herbal herbs with cow urine.
Cow urine?
Yes, because
Wow.
in that area there's one full animal that do bring things for him. So like, but I choose not to ask him more questions about that cow urine because it was already irritating me. But I have no option. I want to shrink the fiber, so I was taking it. So I was there for 3 days, and there was no improvement. So when I was
Wow.
leaving, he gave me some to use also. I took it. It got finished, and still no improvement, no changes. So I went back there again, and I got out one in the bottle, and there was a dead snake in the bottle with some herbal, with some leaves inside it. He gave me to drink. I was like, if this water will solve my problem, I will not take it. So I didn't take that one. So he still gave me another one. So after taking it for like 3 days or so, nothing, no improvements. And that one again, we're making research, asking people again, because we lost avoiding surgery. So they recommend another woman for me again. I went there. When she checked it, when she saw the size, because my own was not even moving, it was very strong and was in just one position. She was like, she has not seen any kind of this thing before, but she will give me what to use. I think we'll melt it. The same thing, the same old story, nothing changes. Nothing changes. But this thing, the place I don't know in Lagos, because of this, just to avoid surgery, I was going from one place to another. One giving me different apps. I don't even, I'm the type of person I don't even like taking apps. And I don't have option. I don't take alcohol, but they will give me the one that is mixed with alcohol. I don't take palm wine, they will give me the one mixed with palm wine, all those kind of things. But it seems as if, as I was taking it, the thing was even getting bigger. So it became my insecurity that I can't go out during the day. I stopped working. I was just at home. No, my brother was just taking care of me.
Wow.
I can't see my clothes. I'm the type of person that love wearing fitted clothes. Now, I started wearing polos. Some people now even be asking me, are you pregnant? You know, all those kind of things. So I was feeling ashamed, all those stuff. And the pressure sign, that one, in fact, I can urinate for, in fact, I can't count the number of times I will urinate even before daybreak. It was really serious. I was avoiding surgery. And I even went to one woman's place. She was like, this fibroid is not ordinary. I became scared again. If something not ordinary, definitely I cannot take it to the hospital now because that one is, I can't even go to the hospital. So I became scared, more scared again when she said it's ordinary. So there was one guy who was not telling me about his pastor, that his pastor can do this. I'm not the type of person that goes to church because of miracle. If I want to worship, I worship God because I believe God answered my own prayer. So because of this thing. So he was just talking about his pastor that man can do this, can do that. I said, let me go and try. All the name of I want to cure fibroid. I'm going to church for miracle. When I go to the church, hey, the pastor was doing miracle. You move his shoe. Bring 20,000, put your leg in my shoe. This thing will happen. Because I don't have faith in that kind of thing. I was just looking at what he was saying. He was wondering nothing. So he just brought out one vision just to you is one Awusa man that is doing you all this kind of thing. I just laugh in my mind that I know the kind of life I'm living. I'm very careful the kind of way I live my life. So this one is saying, just look for ways to collect money from me. After the closing prayer, like I just left. I was still avoiding surgery. Not until I just made up my mind. Let's let it happen. This thing is becoming too shape. I can't go out. I can't go and walk. I can't dress well. I can't. I have to make up my mind. So when I get to the hospital, and I said, because of the side that my womb will remove. Hey, I said another problem again. I was even scared of the surgery that if I do it, I will die. Now they want to remove the womb again. I became more scared. Oh God. When I got home, the first like this was let me eat so that I will have strength to think of what I just said. After eating, I called my brother. Hey, I called my brother and tell them this is what is happening. And they want to remove my womb. I said, God, what would I do now? No, I've not given birth. I want to remove my womb. But I'm using this supposed to just to encourage women. Don't let doctors force what they say to discourage you. The best way to this is surgery. The best way. Oh God. I would just my brother encouraging me that I should not but I should just continue. And God will make it, God will perfect it. So each time I go each time I go for clinic, they told me I did some scan, all those stuff like that. And they were still saying that my womb will remove because of the size of the fibroids and just to keep me alive. So my womb will remove. So even till the day I was admitted, that was the report. I was scared. Let me not lie. I was very, very scared. But all thanks to God. The following day was my surgery. So in fact, my surgery was just like magic. My God. What I was seeing, like, this thing is very, very this thing is difficult. Will I survive? My fear is, will I survive this thing? Because they have been saying that this thing is not ordinary, and I'm going to the hospital. Will I survive it? Will I survive it? I just encourage. I just encourage myself because in our clinic they always tell us what God cannot do does not exist. So I hold on to that word. So on the day of my surgery, I just left. It was so easy for me. I just left. And when I get to the theater, I just close my eyes because I don't want to see those things. I don't want to see those sharp objects. I was so scared. I just closed my eyes. I don't want to see. I slept off and I woke up. Fibroid was gone. My big tummy became flat. In fact, the doctor that woke me up was like, the doctor just woke me up. Kikelomo, kikelomo, kikelomo. I was sitting sleeping. But I touched the stomach. I thought my stomach was flat. I said, okay. We did not remove your womb. We did not remove your womb care. Hey God. I said, okay, I'm ready. I want to sleep. Let me sleep first. When I woke up, now asked Dr. Elori, was my mom removed? He said, no. I said, God, I'm alive and my mom was not removed. Look at, so this thing was as easier, like, I don't know, it was so easy because the way I saw it before, like, it was like a mountain. I was saying the surgery, like, this thing was like a mountain, that it was, after the surgery,
So what you thought
this is
that
what I'm
was
scared
not
of.
ordinary?
It was, why? I said, so, I didn't I knew I would have done it far back
Since
2022. Yeah.
wow.
It was so. Please, I want to encourage women. Whenever I come across any post on TikTok and anybody, please don't look for surgery. I always comment. It is safe. It is safe. It is safe. If I've done my, it is safe. Please. So I'm happy. So this is all
Wow.
I have to say. Thank you very much, doctor.
Thank you so much, Miss Kikelamo, for sharing your journey. So you
You're
started the
welcome.
journey, you started in 2022, and you did your
2022. Yeah, that
surgery
was 4
this
years.
year, 2026.
Yeah.
So that was journey of 4 years.
Yes. 4 years.
Wow, wow, wow,
Yes, 4 years.
wow.
Part of shame. Fine. I
Mm.
can't dress well. No, I was just wearing big. No, no, no.
So surgery that you had thought people had said is not ordinary. So a lot of
It's not
women
ordinary.
that are listening is not
That one
ordinary.
even contributed to it. That it's not
Mm.
ordinary. That this one is
And it
village
made
people.
you
How did
fearful about even coming to the
I
hospital.
offend? Who did I offend?
And the doctor's
Ah,
treat work is not ordinary. Mm. So thank you so
yes,
much.
exactly,
Mm.
exactly.
The Yoruba
Thank you,
people
not
say
that
that
doctor.
ekte se lebo.
So I should have been able. But my surgery was like magic.
Mm. Wow. So thank you so much for sharing. So she delayed treatment and eventually she's here. They didn't even have to remove her womb. And eventually now she can wear that fitted gown that she has always wanted to wear. And she can go out. She doesn't have to depend on her brother or anybody to help her to do things because of a massive swelling. So I just want to ask you before I move to Mrs. Oluwafunlayo, what you have mentioned the advice to encourage everyone, but looking back, what do you think you would have done differently from your experiences, like the 4 years that had gone without going to the hospital? And all this period, you never visited the hospital. You were always going to drink different things and even believe in
Yes,
how to melt.
that-
So, looking back, what
that-
would you have done differently just to encourage another woman here listening? Can you hear me?
yes. I can hear you. So what I would have done is immediately I was diagnosed of that fibroid. I would have done the surgery because the money wasted and the time, the fear, in
Mm,
fact, it was not necessary. So it was too much compared to just this surgery. This surgery it was easy compared to those herbs. I don't take herbs. I don't like it. I don't like, but I don't have option. I was taking different. But there was one this man inserted into my vagina. That one was like pepper. Oh Jesus! For days I
wow,
was not okay. So those
wow.
herbal too, it's not everything was even making to go bigger. The more I take it, the more it was growing. There was no change. It was growing bigger till like made up my mind that this one, let me go and remove. There's nothing that will shrink this thing again. Then I got made up my mind to go for the surgery. And I'm happy I did. I'm very, very happy I did. I'm encouraging every woman. There's nothing there. There's no fear. Even the recovery was so smoothly. My recovery was smoothly. It was okay. I'm getting better every day. Thank you.
Wow. Thank you so much. Thank you so much for sharing. Thank you so much for sharing. So I hope you can hear and you can see how even how well she's talking about the surgery. And just to encourage everyone, if you are delaying intervention or treatment, or if you've not even gone to the hospital at all, you are thinking of going to other places without even consulting a doctor and getting expert guidance as regards your treatment, please and please don't think it's not something that, at least, first of all, go to the hospital, hear from an expert gynecologist, and even know what is even your option for your peculiar fibroid condition that you have, to be able to know the next step rather than going and wasting time and years, on something that you could have even done way early. So thank you so much, Mrs. Kikelo. So I'm going back to Miss Oluwafumlayo. So you talked about how that your life had gotten better, things had changed, and you are very happy about the surgery. So if there's another woman out here that's also afraid about surgery, concerned about the treatment, just like we've heard from Mrs. Kike Lomo, what would you tell her to, based on your personal experience from the fibroid journey and to treatment? What would be your advice to a woman that is afraid, presently listening to you right now? Mrs. Oluwafumi,
So, yeah, I can hear you. I'm here. So you mentioned something earlier. I feel like what makes everybody scared. Nobody wants to die. I think that's the major thing that makes a lot of us scared. We don't want to die. And there's another thing that makes us scared is that the fact that a lot of us still want to be, still want to have children,
children.
and the fact that we've heard that complications from this surgery can, you know, mess up with that. I think that is one of the things that makes everybody scared. But I will just say that for me, one of the things that just helped me is the fact that I'm very much on social media. I like to research things and all of that. And the fact that I went online, I see a lot of people like this phone that we have with us. If you go online, you see a whole lot of people that say that they've done the surgery and they have kids. Can you hear me?
Yes, I can hear you.
Am I
Clear.
still audible?
Yes.
Okay. There are a lot of people that have kids. Like right now, I don't even think that I really hear of people dying from the surgery anymore. I've had friends myself that have also had the surgery. And speaking with these people, I think that a lot of us, we like to think that this is something to be shameful about. And when we overcome this fear and start to have conversations with other people, we get to see that these things are very normal. And when we normalize these things, we then overcome the fear and we see that, okay, I think I can overcome this. We see that this is nothing. The fact that we think that this is something, that we think that it is something so big, something that we cannot overcome, it's one of also the greatest issues. So for me, one thing that helped me was talking to people, watching people's story, and when I noticed how very common it is, how very very easy it can be. Like I said, I've seen a lot of people live their normal life, and I'm just like, okay, what am I exactly scared of? There's nothing to be scared of. This thing is very normal. And I mean, I hear people say 8 out of 10 women have it. I'm like, if 8 out of 10 women have it, what am I even exactly scared about? So that was one of the things that helped me overcome the fear, to be very honest. And I would just really tell everybody that there's nothing, this fibroid thing is not bigger than you. It's so little. It is so simple. Like Miss Kikelo almost said, when I had my surgery, I myself was very shocked with how I recovered. I was not in pain. I was very good. I was very, very good. I had my surgery like a month ago or so, and I don't even know if fibro was the reason why I used to have constipation prior to surgery, but I don't have constipation anymore. And the fact that I'm not scared again, like I just know that, oh, this thing is no longer there. I'm not like a slave to this thing anymore, because when it was there, it was like something that was always in my subconsciousness, and I was always thinking about the fact that, oh, there's still this thing there. I have to overcome this thing. And the fact that it's not there, my mental health is better. If for anything, that alone just even makes it like a win for me. The fact that I don't have to worry about it for a while again. I don't even need to worry about it. Just makes life better for me, basically. The fact that my mental health has just really improved is just like, that's just a win for me, because I cannot even really overemphasize the fact that I had to think of it constantly. It was weighing me down. The fact that I would, always hate the fact when my period is coming, I would hate that period of time. Like I never looked forward to my period. And the fact that I don't need to deal with that anymore is just like, it's just a win for me. And really, there's nothing about fibroid. And this is not to undermine anybody's experience of, but for me and for everybody that I've spoken to, like she has also said, as everybody has said, it's not a big deal. I think it's the fear of the unknown that really makes us very scared. And when we are at that point, and we take this step, we see that this is really nothing that we can overcome at the end of the day.
Thank you so very much, Mrs. Funlayo, for that. I'm sure that every woman that listens to you would be very encouraged. I like how passionate you are about sharing your experiences and even encouraging every of the women that are listening to you. So thank you so very much. So we're going to the question and answer session. Busayo, are you on the call? Let me see. Is Busayo on the call? Okay, she's not on the call. I think network has logged her out. So I want us to take the questions from the chat box. So I'll be starting with questions. So the questions will be to Dr. Smith. I think one question came in when you were talking. So thank you very much for this knowledge. This is from iPhone. I sincerely appreciate your insights. Can you explain the fibroid that is named pedunculated uterine myoma, measuring 67 by 59 millimeters, normal endometrial thickness? I was diagnosed to have irregular outline and inhomogeneous myometrial echo patterns. And can I conceive with it? I'll be glad if this question is answered. Thank you. So this question is to Dr. Smith. Dr. Smith, are you there?
Yes, I'm here. Okay, so can you put the picture again?
Okay, ma, let me share my screen. The pedunculated parts, right?
So let me answer the question I can see about, can a vaginal examination be done for a virgin? So it depends on why you need to do a vaginal examination in the first place. If a vaginal examination is absolutely necessary, yes, it can be done for a virgin. It just means that the hymen would have to be broken and the person technically would no longer be a virgin. But that depends on what your definition of virginity is. So most times we don't bother doing a vaginal examination for someone who has never had, or somebody who is a virgin. But if, for example, you have to do it because, it's a life-threatening, you need to make a diagnosis that is affecting the patient's life, then we're not interested really whether one is a virgin or not. We need to do that thing, or we need to do a procedure. It has to be done. There's no two way about it. Okay, so when you say pedunculated, you can only have pedunculated, either a pedunculated submucosal fibroid, which is, so pedunculated just means that there's a stalk. We usually use mushroom to try to describe it. So mushroom has a stalk and then something a head or an umbrella, or yes, use an umbrella. So pedunculated means that there is a stalk, there is a tail, or however you want to try to explain it. So you can only have a pedunculated serosa, which is on the outer lining of the womb, but is not in direct contact with the womb. So there is a stalk, you know. This diagram is not really showing that though. And then we have the pedunculated submucosal fiber. If you can get another picture that will really show it better. So that's it. Um, I always say, so one patient send me, so when patients send me DMs and say this is my scan result, and all that, it's not really just about looking at the result. There are many times whereby patients come, I look at the scan reports and I examine the patient and they're not telling, because one thing I've noticed is that scans never tell you the exact number of fibroids. A scan will tell me 4 fibroids and you go in and you bring out 10, 20 fibroids. So how come the scan didn't pick it? So it's not as if the scan didn't pick it, but the sonographer did not describe it, just described the ones he wanted to describe or the ones he felt, was important. And again, they can't see everything. So it's going to be very difficult for me to answer the question this person is asking. Let me see. I'm trying to see the question again. I can't answer if you can conceive with it or not. It's difficult for me to say, because I don't know if it's a pedunculated serosa fibroid, it's not related to the uterine cavity, so it should not, But then again, I cannot 100% say if that is the only fibroid that you have. I don't know if you were here from the beginning, but I know at a point in time, I talked about fibroids and infertility. And, we've also had many patients with fibroids get pregnant and deliver successfully. So having fibroids does not mean you cannot get pregnant. We only just try to advise people who have fibroids, and we're not taking out the fibroids, to try to get pregnant if they are ready to get pregnant. Why? Because one, we do not yet know whether the fibroids will prevent the person from getting pregnant. Scans may not be able to show the exact location of fibroids. So we don't know, are the fibroids blocking the tubes? Are the fibroids blocking the cervix? We can't answer that. But if somebody gets pregnant, then we know for sure that that fibroid is not preventing the person from getting pregnant. So it's until you try to get pregnant that we can 100% say, But yes, can fibroids prevent one from getting pregnant? Yes. But many people with fibroids actually do get pregnant, So it's not a condition whereby you say, oh, once you have fibroids, you can't get pregnant. No, it doesn't work that way.
Okay. Thank you very much, Dr. Smith. So in summary, we cannot really say for certain until you try to get pregnant, and we can't answer the question because that may not be the only fibroid that you have. So thank you very much, Ma, for your insights on this issue. So another question from Catherine Oseni says, as a single lady living with multiple fibroids, though not in the uterus, and has been advised to do a myomectomy, how can I possibly manage it without the surgery? Then another question says, is it possible for a lady who is not ovulating to have fibroids? Dr. Smith, ma.
Okay, so let me start with the last one. Is it possible? Yes, because they're two completely different things. Not ovulating it's not related to fibroids in any way. Um, um, One cannot 100% say that somebody is not ovulating forever, So if you're not ovulating, doesn't mean that you do not have the hormones. If one is not ovulating, depending on what is not, depends on what is causing that. We're usually worried about low progesterone, but the person is still producing estrogen. And like I said earlier, estrogen is responsible for the growth of tissues, growth of cells. So as long as your ovaries are producing estrogen, fibroids can So I like to use the word can because it's not compulsory. There are people that, have normal levels of estrogen and they don't have fibroids. So yes, they are two completely different things. But if you say that, can somebody who is in menopause not have fibroids? Yes, because once you're already in menopause, your ovaries are almost technically shut down, so you have low levels of estrogen, less stimulation. So it's very rare for somebody who did not have fibroids at all to now develop fibroids after menopause. Um, I don't know if I answered the two questions. So I think that was the previous question. Sorry, I missed the first question you asked.
The first question was concerning if somebody diagnosed with fibroids, she's single, if she can manage the fibroids without it.
Okay, yes. Okay, so I think I also mentioned that not every fibroid requires surgery, and there are indications for surgery. Now, it's not everybody that has fibroids that are symptomatic, so it depends on what symptoms you have. So I mentioned different treatment options, whether we're just watching and monitoring with scans, whether we're giving medications to reduce blood loss, whether we're giving medications for pain, whether we're doing minimally invasive surgeries or we are going and we are doing surgeries. Now, the options or the choice, it's a conversation. It's not something that you will see online. What works for A may not work for B. Do you understand? Because everybody is different. So the choice of option would depend on your age, the location of the fibroids, the sizes of the fibroids, the number of fibroids you have, what symptoms you have if you want to get pregnant. I know that I had a patient early in the year that I did a myomectomy for, and I would not touch a patient without saying all the likely complications and steps and strategies that we're going to take to try to minimize or prevent these complications. So she had fibroids in the uterine cavity, and so I explained to her that once we remove the fibroids from where, so uterine cavity is usually where the baby stays. And at times, when you remove fibroids from there, in the process of healing, the uterine cavity gums together. And then I don't know if you've heard of people that they had a myomectomy and after that they're not seeing their periods. So usually we would put a balloon to try to keep the walls of the uterus apart so that they don't gum together. And so when I mentioned that, she was like, I'm never interested. I don't want to get pregnant. I don't want to have children. So your symptoms, the management options really depends on what you want. So I can't have that conversation here because we need to now have a conversation as to, I need to examine you. I need to see, are the fibroids causing pressure symptoms? Are they, so that will now determine exactly what needs to be done for you. Thank you.
Thank you very much, Ma. So I think that also answers another question that was asked about if it's all fibroids that need surgery. So I think we have answered that specifically, that we cannot really say not all fibroids may need surgery because not all fibroids are symptomatic. There are different modalities of treatments for fibroids. If it's not bothering you, you don't need to take it out. Thank you, ma'am. So the last question for now. Does fibroid cause any sort of hormonal imbalance?
No, it doesn't. I feel that maybe because when we talk about hormones, and we say that, fibroids are seen in women in reproductive age group, you don't see fibroids in people that have not started at periods. People just assume that, yes. So the thing is that, yes, fibroids are, growth of fibroids are stimulated by the hormones that we produce. But fibroids do not cause hormonal imbalance. It's not like PCOS or PMOS where there is, normal level of estrogen, low level of progesterone. That's not the case in fibroids. Fibroids they do not cause hormonal imbalance. They are not caused by hormonal imbalance. It's just your hormones the normal hormones that you produce that stimulates the growth. So your tissues may just be sensitive to. So you and somebody may have the same level of hormones, but one may have fibroids, the other may not have fibroids. So it's also how your tissues respond to the level of hormones. So no, fibroids do not cause hormonal imbalance.
Thank you very much, Ma, for the question, for answering the question. We have another question here that says, why do fibroids keep growing back after surgery? Why do fibroids grow back after surgery? What is the length of time between a surgery for removing fibroids and when it would recur? How long does the lady have before it recurs? I'm trying to group the similar questions together. So about the recurrence of fibroids and why it happens, the length of time before a fibroid grows back, and if it grows back, is it true that it will grow back bigger or smaller?
Okay, so one, fibroids don't grow back. So the problem I have is with that terminology, grow back. Fibroids can grow. New fibroids will grow. And that's why I said earlier that the definitive treatment for fibroids is removal of the womb. Once you take out the womb, which is what harbors the fibroids, one can never ever have fibroids again. But as long as the womb is still there, whatever caused the fibroids in the first place is still there. So fibroids can grow. So it's not cast in stones that, once you do a fibroid surgery, and I think I tried to explain with different scenarios. The patient I had that was using some herbal mixture, that our fibroids actually completely shrunk, but the minute she stopped using it, it grew back. So it's for me, it's whatever modality you use, as long as the womb is still there, fibroids can grow back. That's just the honest. No, sorry, you guys have put that word in my mouth. New fibroids can grow. We say that the young shall grow, and that's why at times when we're doing fibroid surgery, we try to remove every single fibroid we see, even if it's as tiny as a seed. We try to take it out. Why we don't take it out? You've left a fibroid. Over time, that fibroid will go bigger. And then, it may not have been seen on scan before because it was quite small. But then 6 months later, you now do a scan, and scan shows you have fibroids, and you're confused. Is it a new fibroid that is growing, or a fibroid that was there before? So we always say the young shall grow. So as long as whatever caused the fibroid before is still there. But some people are lucky. There are times whereby we've done 2 myomectomies. So a patient has had myomectomies twice. And that's why I try not to always start with a myomectomy, except it's absolutely indicated, absolutely necessary, so that you don't do a myomectomy and in another 5 years have to do another myomectomy. So we try to modify certain things in our lifestyle. Healthy living, take lots of fruits, vegetables, avoid red meat, avoid processed foods, just be naturally healthy, have a good weight, exercise to try to reduce the chances. The sad thing is that at times, even if you do all of this, fibers will still grow. But then again, I've had patients that I operated, did a CS4, we had a fibroid, even scans showed fibroids before then. And, years after we do a scan and we don't see fibroids. So there are two things. Either the fibroids shrunk naturally, which can actually happen. The fibers can actually shrink on their own. That's if they were never really big in the first place. Or the sonographer did not look for that fibroid, did not see the fibroid, or saw the fibroid and felt that it wasn't significant, and so did not mention it in his reports. So, it's difficult to say how long it will take, how fast they grow. If if you do a fibroid surgery and you remove 50 fibroids from somebody, that person, the chance of that person developing fibroids again is very high. Because what made that person have that many in the first place is still there. New ones will grow. May not get 50 at once, and nobody ever starts with 50. It always starts as small, and then so one time it's one fibroid, and then three, and then they increase in size. But because making a diagnosis is usually mainly by scan, and really, how many times do we go and do a scan? So most times the scan is usually done because there was a reason. But then again, companies that do these annual checkups and do scans monthly, you can actually use that as a way of monitoring and checking. So anytime you go and do a scan, just ask the sonographer, if you're doing a pelvic scan, just ask, do I have fibroids? That may make them actually look and say, oh, you have one, or it's very small, then you've noted that, okay, I already have a fibroid. So that the next time, if they now say you have 5, you on your own can even do the mental picture and say, oh, okay, last year was 1, now it's 5. It seems like fibroids are growing. I'm having more fibroids. Because if not, if you just do a scan once, we will never really know. We'll never see the growth. We'll never see a pattern. So that's it. So it's difficult to say. Some people are lucky, they do a fibroid surgery and no new fibroids grow. Others are not that lucky. You do a fibroid surgery, 6 months later you check, and then you're seeing fibroids again, and then you're wondering, is it that they didn't remove all the fibroids in the first place?
Thank you so very much for the response. So we have someone is asking again that, is it all fibroids that need surgery? I think you've answered that already. Can fibroids grow after surgery? I think you just answered that. Then does birth control increase the person's risk of having fibroids or reduce the risk? Then somebody saying, aside from, the same person, as Lua Busayo, aside from surgery, what other way can fibroid be taken out? I think you've talked about the treatment options for fibroid actually, but probably she wasn't here when you had that conversation. But after the conversation, the link to the recording will be made available. So I think you can just touch on the how birth control increases the risk or reduces the risk of having fibroids.
Okay, so we know that hormones they stimulate the growth, and fibroids are sensitive. Fibroids have what we call receptors, so the hormones bind to these receptors and they cause the fibroids to grow. So some fibroids are estrogen sensitive, others are progesterone sensitive. So we never actually give um, birth control pills to shrink fibroids. Doesn't necessarily work. You can use it for people that have heavy menstrual bleeding. You want to try to reduce the blood loss, make the periods a bit lighter, so that can work. But it can do one of two things, but not necessarily to shrink fibroids. It can actually cause fibroids to even grow more for those that are actually sensitive. So if your fibroids are, for example, progesterone sensitive and you're taking progesterone contraceptives, yes. There are times whereby for patients who don't want surgery, who have heavy menstrual bleeding, also are looking for a method of preventing pregnancy, we can actually use hormonal intrauterine system, just like an IUCD, but with hormones, So that one, it doesn't cause shrinking of fibroids, but it thins out the lining of the womb, so their bleedings become less, So if that's just their main problem, and they don't want surgery, so you could do that. You've solved their problem. You've not solved the cause of their problems, but at least you have relieved their symptoms. So that's it. So like I said, most times somebody, so that's the issue at times I have with online, all these people that come
Conversation.
online and say a lot of ABC. Oh, I use this, I use that, I use this, I use that. You
Mm-hmm.
used it, it worked for you. Yeah. But you the person that is watching that video, you don't know what you have. You can't just assume that, oh, okay, it worked for A. Our
Mm-hmm.
bodies are the same because we are both females and we're both blacks, so it will automatically work for me. No,
Mm-hmm.
that's a conversation that you have with your doctor.
Mm-hmm.
I always tell people that if you have a medical condition, whatever it is, you should know it more than your doctor. I have so many conditions that are in my head. Do you understand? So I shouldn't know it better than you. So I would never feel bad if you come to me and say, oh, Dr. Smith, I saw this online. This was a treatment option. Do you think it will work for me? Then I can now highlight and say, okay, fine. Like I said, for example, you trying arterial embolization, I don't recommend it for people that would still want to get pregnant. I do not recommend it for young people. And I will explain the pros and the cons. And that's the thing. Every option, there are many options. Every option has a pro, every option has a con. Every option has an indication, that okay, it can work for this condition and may not work for this condition. For somebody who is complaining of pain, why am I prescribing a medication to reduce her blood loss? Doesn't make sense. That's not her issue. So why am I giving her something that she doesn't need? Do you understand? So the different options are conversations that you have with your doctors. There's nothing wrong in you doing your research, finding. I have patients that tell me I'm using this supplement, using that supplement. I'm just like, okay, no problem. So we see this supplement cannot work, and this is the reason why, and this is the evidence. Unfortunately, because those TikTokers and is it Instagrammers, their voices are louder than our voices. So you get to hear them more than you get to hear us. So whatever it is you hear from them, please go back to your doctor and ask. If not, you're going to be doing more harm than good to yourself. I know having sex does not increase the chance of fibers growing. Whoever told you that just does not want you to have sex.
Thank you very much, Ma,
Oh,
for
so is it not having sex increases the chance of fibers growing? No, that's not true. So whoever is telling you that wants you to have sex, maybe it's your boyfriend and is looking for an excuse to have sex with you. So no, they're two completely different things.
thank you, Ma, for clarifying that. So, I don't know if there's any other person that still has any question to ask Dr. Smith or to ask any of the panelists that have shared their experiences. I'm trying to scan through the questions from the Google form so that we can also answer those questions that have come way before. My question has not been answered. Oh, so sorry, Jenny. Which of your question? How long does it take to have irregular flow after fibroid? Scanty flow of a day or two. Does left lower side pain okay, is left lower side pain a risk factor to fibroid even after successful surgery? Jenny, I'm not sure I got your second question well, but your first question says how long does it take to have irregular flow after fibroid surgery? I'm assuming you mean after a fibroid surgery, or you mean after a fibroid diagnosis. So, Dr. Smith.
Okay, so after a myomectomy, your period may change or may still be the same. There are times I've operated patients because of heavy menstrual bleeding, and their first period after the myomectomy, they still say, oh, it's painful, it's still heavy. And so the reason for that is if somebody's uterus was as big as a 9 months pregnancy,
Mm,
even when you take out the womb is not going to go back to, the way it was before fibroids started to grow. It's still going to be big. It takes a while. It takes months for that uterus to now shrink and go back to the normal size. So as long as the womb is still big, you can still have pain. You can still have heavy menstrual bleeding. But usually by the 3rd month, that stops. Now, when I do a fibroid surgery for a patient, I'm worried. So I'm always concerned about their bleeding. So when they say their bleeding is heavy, I always tell them, I'm happy that your bleeding is heavy, because if your bleeding is scanty, I'm worried. Okay. Now, I tried to explain earlier that when you have a fibroid surgery and you have fibroids removed from inside where the baby stays, during the process of healing, depending, okay, on how extensive the incision was or how big the fibroid was removed, the 2 walls may join together during the process of healing. It's just like you opening a book and pouring gum, and not keeping it aside. So if you make a mistake and you leave one side of the paper, what happens? It falls on the other side, and then you may not be able to separate it. So that's one complication that may occur with a fibroid surgery. And so if your period is scanty after a fibroid surgery, it could be that has occurred, that the lining of the womb has joined together, or either because the fibroid was removed inside, and then during the process of healing, they joined together, or there was infection that occurred after that damaged the lining of the womb. So I think whoever it is still needs to go and see a doctor. I don't know if this is the first period. I don't know how many periods you've had after your myomectomy. I don't know if it was just a one-off. So if it was just a one-off thing and subsequently your bleeding has increased, not to, using 7 pads per day, that's not normal, but, maybe 3-4 pads a day and then bleeding for less than 7 days, or what it used to be, depending on what your pattern is normally, then we are good. But if it's still scanty and it's progressively getting worse, that's not a good sign. So you need to see a doctor. Pain, I don't really understand pain, and I don't know what to mean by successful surgery. So after a surgery, depending on the extent of the surgery, depending on your pain threshold, depending on if you have previous adhesions, you can have pain. It depends. Pain may not be excruciating, but pain occurs, one, because the body is healing, So the process of healing, you may have pain. So if you're concerned, then do a scan, okay? Do an abdominal pelvic scan, and let's see if there's anything inside the abdomen.
Thank you so very much. And pain can even be from the healing process that is occurring after the surgery.
Yeah.
So thank you so very much, Dr. Smith, for taking your time to answer the questions. I hope your questions have been answered, Jenny. Thank you so very much to the panelists, Oluwafunmilayo, Mrs. Kike Lomo, Susan. Unfortunately, the last panelist couldn't join online for some reasons. But I'm happy that we were able to have this conversation, and I hope everyone has been able to, learn, answer, have questions answered, get clarity as regarding fibroid, wrong information that you've heard, get clarity. You've heard stories, you've heard facts, you've heard medical knowledge, information, and we've also, gotten guidance, and cannot overemphasize the importance of having to meet with a doctor, have a conversation with a doctor, and don't just assume that, because this person did this person used this drug and is working. You might not even know, like she mentioned, there are some drugs that even affect the ovaries. So it could even be that you are saying that the swelling is reducing, but it's also already causing another damage internally that you cannot even hold on to because you are not a doctor. It could have been affecting the kidneys, and this person might not know. So please and please, you can see even from the stories that the different panelists shared, when they interacted with the doctor, they were able to get clarity, and it also helps them in making the adequate decision or the right decision regarding their diagnosis, which is what I want everyone of us on this call to go home with, because there's hope. And doesn't mean that fibroid diagnosis is the end of life. You can thrive, do well, excel, and have children and will not die, even after a fibroid surgery. So I also want to encourage us. You can connect with Dr. Smith on Instagram. Instagram name is Celebrity Doctor. Let me see if I can the link.
The celebrity consultant.
Sorry, the Celebrity Consultant. Let me see if I can put the link on the chat box. So you can connect with her if you want to have a one-on-one conversation with her. Like she mentioned that it is the fibroid journey is not one size fits all. So you don't expect that what works for, or because person A did this, it means that you have to go through the same process. Yours might be different because of the size, because of the location, and because of the peculiarity of yourself and even your other health conditions. So please and please do well to reach out to her, connect to her, and I think she would put you through on how you can reach out to her if you want to meet her physically. She has a private facility where you can consult and even receive treatment following that. So the fibroid conversation doesn't end here. It continues even to our homes, our place of work. So what you've learned today, please do well to reach out to other women, correct the wrong information that they have, educate them with what you've learned today, and at the same time, research, like Oluwafumlayo said, research and get clarity and get more information as regards fibroids and the different treatments. So in line with talking about research and getting more information, I'll be launching a book very soon, which is titled Living Beyond Fibroid. And many questions that you might still have, or you will have subsequently, or you still have that might have not been clearly answered, will be answered in this book. So I'll be launching the book in this month, August. I'll share the link on how you can get the book and how you can purchase it. So for as many women that are on this call, you'll be getting at a discounted price and also at a pre-launch price too. So it's like double discount for you because you're on this call. So I'll be sharing how to get the book. I took out time, gathered stories from different women, understood the realities, the peculiarities, the questions that women have, the fears, the concerns, and even that was what also encouraged me to have this conversation. Let's hear from people that have really lived this fibroid journey. It's easy for us to say, oh, this, that. But when we are here, when you heard from someone like Miss Kike Lomo rather, and Oluwafumlayo, you can hear from them, hearing how that she had to even take cow urine just because she wanted to shrink the fibroid and not do surgery. So this book is also like a way to simplify, help you to understand fibroid, the management, and also even how you can thrive beyond just the fibroid diagnosis and not get overwhelmed with the symptoms, peculiarities, or even the confusion of managing fibroid and fertility. So I'll share the link on how you can get my book. People are not clapping, are not excited. Now, wow, all the effort I've put into this book for you. It is well. Why is nobody's clapping? Okay. Thank you. I can see the applaud now. Thank you. So do well. Look forward to seeing the book. If you're on the group chat, I'll be sharing the link on how you can get the book. And the discount for as many women that are on the call today, and also the pre-launch price. We'll be launching it this month, The dates will be communicated to everyone, either via email or on the group chat. But I'd love us to take this conversation beyond this place. From now, tomorrow, at work, when you see women, please tell them, have you heard about fibroid? What do you know about fibroid? Hear from them and correct what other wrong information that it is that they have. So let me quickly put in the link on how you can connect with Dr. Smith. Let me see. Oh, okay. My laptop is acting up now. Okay, but if you're on the group chat, I'll be sharing the link on how you can connect with her. You can also check now as you're on the call, the celebrity consultant on Instagram. So please do well to follow her. In fact, before we end this conversation, please, I want you to go on Instagram and follow her. She has taken her time. We've been here for almost over 2 hours talking about fibroid, answering your questions, concerning fibroid, giving you clarity and helping you to know the best decision concerning fibroid. So please do well to follow her. That's the best that we can do to appreciate her for being here tonight. Thank you so much, Dr. Smith. And as you're following Dr. Smith too, please do well to follow me too, It takes a lot to bring great people together and even to organize this. So do well to follow her on Instagram, follow me on Instagram to also get more information regarding women's health beyond fibroid. She talks about a lot of things. Recently, she talked about cervical cancer, which is also very, very important for a woman to pay attention to, not because we want you to have cancer, but because we know that you can prevent cervical cancer. So please do well to follow her, like, even turn on your notification so that whenever she posts online, you see it and you'll be able to learn from a wealth of knowledge. Thank you very much once again. The WhatsApp group chat will still be open for other information that I'll be passing across. I would like to get your feedback, what you think we can do better. How was the webinar? In fact, before we close, how was the webinar? Not webinar. How was the conversation? Did you enjoy it? How was it like? I want to hear from Catherine. I know Catherine has been listening from the very beginning, and she even asked question. Catherine, how was it for you?
I need to type or not. Good evening.
Good evening.
Yes, so the conversation has been quite insightful, helpful, and then an eye-opener, really. So for me, I really enjoyed every session from Dr. Smith to the panelists, and then I'm sure that this would further help my decision. Thank you so much.
Thank you too. Thank you for joining, and thank you for also engaging. Okay. So Zoom users, I enjoyed it thoroughly. I learned so much from here. Thank you. So let me call on one more person. How was the experience for you? Let's see. Or is there anyone that wants to unmute and just talk about how the experience was for them? How was the conversation?
Hello, good evening.
Good evening.
Yeah, my name is Okiki Joseph from Ibadan.
Nice to connect with you.
Yeah, I've really learned a lot from this conversation, and it has really been educative. Although, yes, I used to have had fibroid sometimes ago, and I did myomectomy, and at the time after 2 years, it regrew with doctor said not to regrow, new ones grow. Because my belief was that it does regrow. That's what people say. That it once you do it, it will regrow. So then I was pregnant, and new ones grew back. With the
Mm,
baby. But after giving birth, I just noticed that for a whole month I was bleeding. I bleeded for a whole month after birth. So after that, I went to go and do scan, and they said the fibroid was not there again.
Mm.
So I was like, okay, it seems this has flushed that, because it was like 50-50 that I was going to do surgery so as to bring out the baby and the fibroids together. But I gave birth through normal delivery. And after the normal delivery, I bleeded for a month, or 30 days at a stretch.
Wow.
So, and from here, I have learned a lot about the symptoms, about the misconceptions
Mm.
that people have concerning it. Yes. And I too, I used herbals even before then.
Mm.
I used herbal, spend a lot of money, but there was no changes until I did the surgery to remove it. Yes. Thank you. So thank you for this opportunity. I'm really grateful. God bless you.
Thank you so much for sharing your experience. Thank you so much. So, while you were talking, something just came to mind, and I would love Dr. Smith to just touch on it. Sorry that I'm taking us longer than expected. About fibroid removal and CS. I know some people say that, oh, once I do CS, they can remove the fibroid with it. And I would just like Dr. Sweet to touch on it. I know it's not a surgery that we do, especially regarding the blood loss that comes with fibroid surgery. Dr. Smith, are you there?
Yes. Okay. So, fibroid surgery used to be a bloody surgery. Okay. But now with advances and techniques, there are things that we can do to try to reduce blood loss during surgery. One of which is like tying the neck of the womb to cut off blood supply to the uterus during the period of surgery so that one is not bleeding. Now, for that to happen, maybe you will give them my other Instagram page. So on my other page, I usually do Sundays are for harvesting fibers. So if you watch, you'll see some of the videos. We usually remove the uterus out
Mm.
of the body. So you see it outside the body. You can't do that for a fibroid for a pregnant patient. Do you understand? It's not very possible, depending on how huge the fibroids are. So imagine during pregnancy, the uterus is big, obviously. And so there's also increased blood flow to the uterus. And so it means that if you try to do a fibroid surgery, you're going to have more blood loss.
Mm.
That's the same way for some. I mentioned earlier that there's an injection that we can give to reduce blood loss that will try to reduce the size from like a 9 months pregnant uterus to like a 6-7 months pregnant uterus. Why? Because you're trying to conserve bleeding and reduce the blood loss. So we don't routinely do a myomectomy during a CS. Why? When you cut for a CS, may be different from where the fibroid is. So if you have fibroid on top of the womb and you're cutting at the lower parts, what is it that when you're done, you now want to go and cut there to remove the fibroid, the bleeding is going to be excessive. Except you have a blood bank that has plenty blood ready for you. We don't routinely do that. So that's number one. There are times whereby after a CS, once the baby is out, some people will decide to bring out the womb to repair it. But there are times whereby you can't do that because the womb is big because of a fibroid. So it means that instead of doing the bikini cuts, you have to do like an up and down cut, which
Mm.
really is not necessary, because the whole idea is just go for what you are going to do, which is just to remove the baby. Now, if you decide to do a fibroid surgery while you're doing a CS, you are increasing that duration of surgery. CS on its own is bloody. At times, the bleeding is usually in excess. Okay, so if you compare a CS and a vaginal delivery, you bleed more during a CS. Do you understand? There's something we call postpartum hemorrhage, whereby a woman bleeds in excess after delivery. So that can happen even without fibroids. Then you now say somebody has fibroids, you now want to remove fibroids doing. It's like you are trying to test God's love for you. I'm not even saying testing your skills. You want to see whether God loves you enough, and so you want to experiment with patients' lives. Now, but can you remove it if necessary? Yes. Have I removed fibroids when I'm doing a CS? Yes. Not because I wanted to, and the fibroids were not huge, maybe like a tennis ball. And that was because if where I cut, there's a fibroid below where I cut, there is no how I'll be able to close that uterus back together because that fibroid is there. And it wasn't as if I knew there was a fibroid there. At times you can see that that's the one that is inside. But the one that is inside the wall of the uterus, you may not be able to, it is only after you've cut that you see that, oh, you cut over a fibroid. And so you may not be able to repair that cut properly. So in such a case, you can attempt to remove the fibroid. But that one may not cause patient to bleed, yes. But patients, the bleeding will not be so much because it's a small fibroid. Now, if somebody has 20 fibroids and I remove one, have I helped the patient? Not necessarily. So if I cannot remove all the fibroids, why am I selective and why am I bringing out any fibroids? So the only times we remove fibroids is if one, you cannot get to the baby because of the fibroids. The surgery I did last week, I think I mentioned it that the baby was in between two fibroids and the fibroids were huge. And I was just teasing my assistant and I said, should we remove this fibroid? Everybody in theater shouted, no, because everybody knows what that means. It means you're going to sleep inside that theater because that patient will bleed and you may not be able to stop that bleeding. And this is our first pregnancy. So why do I want to start something that at the end of the day, I may end up having to remove a womb because I can't control bleeding? So but I remember when I first started residency, there was this patient that had this huge uterine fibroid. When she was 8, I can never forget her. When she was 8 weeks pregnant, her tummy looked like she was 9 months pregnant already. So when it was time to deliver, there was no how. We could not get to the baby. We had to remove a fibroid before we could remove the baby. And guess the weight of that fibroid? 3.2.
Wow.
That shows how big the fibroid was. Because we kept cutting, but we could not get inside the uterine cavity. That fibroid was in the way. There was no how we could. Did she bleed? Yes, she bled. But is she alive? Yes. But if God forbid she had died, everybody will understand why. So we don't usually we don't experiment. We don't play with people's lives. Um, I know people want 2 surgeries at once. Why do I have to go through? So like the patient I talked about last week, I've told her in the next 6 months she needs to come back for a myomectomy because she should not get pregnant like this. She did not get pregnant again with this fibroids. Surgery was difficult already. She was lucky. If God forbid I couldn't deliver that baby, or it took a while for me to deliver because I couldn't get access, would have lost the baby for no reason. You know. So we don't routinely remove fibroids during surgery, except the fibroid is in your way. You cannot stitch, or you cannot get to the baby because of the fibroid. And the most common complication that we anticipate is bleeding. So bleeding is usually in excess. 2, if the fibroid is very big, if you don't close that space well, blood will accumulate inside that cavity, and it's a focus for infection. So there's really no point. So it's just best go in, do what you want to do, and leave. Do not create unnecessary emergencies. It's not worth it. Every surgery needs to be planned. And unfortunately, a cesarean myomectomy is not something that you should say, okay, I'll get 6 pints of blood, because the bleeding may be in excess of that 6 pints of blood that you think It's bad enough that normal CS is as if you open tap and patient is just pouring. You now say you want to remove fibroids together. No. Okay, so that's
Thank
it.
you so very much, ma. Thank you very much. Thank you so much. Please, a round of applause for Dr. Smith again. Virtual applaud, virtual applaud. So with this, we'll bring this meeting to, or this conversation to a close. So thank you so much for joining. Thanks so much for joining. Let's keep the conversation on. Let's keep learning. Look forward to seeing the link or to the ebook, Living Beyond Fibroid. I'm super pumped up for that because I know what you're getting, and there will be other attachments, add-on things that's be coming with the book. So thank you so much for joining. Thank you so much, Dr. Smith. Thank you, Oluwafunmilayo, for your time. Thank you, Miss Jimo, and everyone that's participated this evening. I'm super grateful, and I'm glad that everyone left here with hope, answers to questions, clarity, and are much better than when they joined before now. So thank you very much, and do have a wonderful night rest. Bye. Please don't forget to follow Dr. Smith on Instagram, please.